Hello, my name is Haley Ferrigno. I'm currently a third-year student at Monmouth University, majoring in health studies. I completed my internship at a Woman's Place OBGYN. In this practice, there are 5 female doctors, 1 male doctor, 3 midwives, and 1 nurse practitioner. We have 3 locations, Colts Neck, Little Silver, and Lakewood. During my time here, I was able to work as a medical assistant and also shadow many of the doctors. As a medical assistant, I called patients into rooms, took their height, weight, blood pressure, and chief complaint, and charted it into the EMR system. During my internship, I had many learning opportunities. The first opportunity that arose was when we had a patient who was suffering from recurrent miscarriages. I decided to do some research to learn what could be the cause, and from UCLAhealth.org, I found that the causes could be due to genetic or chromosomal abnormalities, random events, advanced maternal age, thought to be due to poor egg quality, an abnormal uterus, or a woman's immune system. In addition, while talking with our patients, many of them asked me if we were recommending the COVID vaccine for pregnant women. Since the vaccine is still pretty new, I did some research and found a study published by Harvard Medical School, and I learned that there were no pregnant participants included in the vaccine clinical trials. However, the risk of severe illness and death among pregnant women who contract COVID-19 is slightly more than those who are not pregnant. It has also been found that COVID-19 can increase the risk for premature births. The CDC is currently tracking 30,000 vaccine recipients who were pregnant at the time of vaccination. So far, pregnant patients are reporting the same symptoms as those who are not pregnant. There has been no miscarriages, stillbirths, or preterm births linked to the vaccine. During my internship, I learned much more and was able to experience seeing twins on an ultrasound, witnessing the doctors give the patients the sex of the baby, which is very exciting, and watching new mothers hear their baby's heartbeats on an ultrasound machine for the first time. Day to day, the doctors in our practice see patients for various different reasons. They perform routine care for patients throughout their pregnancy, perform annual exams which include breast exams and pap smears, and problem visits ranging anywhere from breast lumps to urinary tract infections or yeast infections. In between patients, the doctors make phone calls delivering lab results to patients and answering any questions. Each of our doctors also has an on-call night or day when they are in the hospital delivering babies, performing various surgeries, and seeing patients who come in with emergencies. In order to become a doctor, you need to be very dedicated to your studies, and since our healthcare system is always improving, staying up to date on the newest technology and techniques is imperative. There are always new training and courses and certifications that can be gained throughout the career of a doctor. In addition, in order to succeed, doctors have to be personable and empathetic. In order to become a doctor, you need to go to a 4-year university, obtain a bachelor's degree, then take the MCAT exam to get into medical school, which is another 4 years. Following medical school, you have to complete a residency program which ranges, depending on the hospital, from 2 to 7 years. After residency, you must take your board exams to become a licensed medical doctor. Since people always need medical care, there will always be a need for doctors wherever you go. Specifically in New Jersey, we have an aging population and elders typically require more medical care. According to the U.S. Bureau of Labor Statistics, physicians and surgeons are among the highest paid occupations with a median wage of $208,000 in 2020. Overall, I really enjoyed my internship at a Woman's Place. I was able to complete all of my learning objectives, which include observing the quality of care received between patients and doctors during a pandemic, developing professional relationships with office staff, and advancing my medical assistant skills. I'm looking forward to continuing my journey of becoming a doctor.